You're listening to a CNA podcast.
Hi, I'm Andrea Heng. Welcome to the Money Talks podcast, and this episode was produced in partnership with the Ministry of Health. Now, I know someone who recently had to go through a major surgery in a public hospital. She stayed in a subsidized ward for about 17 days, and during her time there, she went through rounds of x-rays, MRIs, and then there's physiotherapy. So the bill came up to over $40,000 before government subsidies. With subsidies, it was reduced to about $11,000. But with Medisave and insurance, she didn't have to fork out any cash. But what if you're not like her? You're someone who either doesn't have enough in your Medisave account or the right kind of insurance, right? So Singapore may have one of the best healthcare systems in the world, but we're also expensive. And even though, yes, we have Medisave and numerous other schemes to help lighten some of that financial load, medical costs are climbing. It's no secret. So we have to be more strategic with how we spend on our health. So to help us unpack why medical costs are getting more expensive and how to lighten the load is Dr. Jeremy Lim. He's Associate Professor at the NUS Swee Hock School of Public Health. Dr. Lim, good to have you on the podcast.
Thank you very much for having me.
It's a pleasure. So there's been a lot of talk about how medical care in Singapore is getting more and more costly, more expensive, and we feel it most of all.
Yes.
So give us a summary, perhaps, of why this is the case.
Well, there are three key drivers for this. The first, as is obvious when you just walk down the street, is that we as a country are rapidly aging. And I think that these statistics have been thrown at us. By 2030, 1 in 4 Singaporeans will be over the age of 65 years old.
I have that memorized in my brain
Yes,
now.
excellent. And these have profound healthcare cost implications because very understandably, the older you are, the more likely one is to have some form of chronic disease requiring regular healthcare visits. The second driver is really rising expectations.
Right.
We are no longer a third world or low and middle income country, and very understandably, very reasonably, Singaporeans do have high expectations of not just the healthcare services, but the sort of quality of life that we have in our senior years. And finally, of course, medical technology has been nothing short of phenomenal. Many diseases that used to be incurable are today really chronic diseases, right? And we just have to think and look back to how we used to treat, say, heart attacks 70, 80 years ago, aspirin, oxygen, dim the lights and bed rest. Today, we have angioplasties, we have ECGs that are transmitted from the ambulance to the emergency departments, and everything is really nicely laid out. We have multi-$1,000 stents put into the patient, and a day or two later, the patient walks out.
I know. I think that's amazing, the medical advancements today.
But all these come at a price.
Yeah, and especially in today's environment as well, where all we've talked about is inflation. The cost of living itself has gone up, hasn't it? And that's a contributing factor.
Yes, because in virtually any health system, the biggest cost driver is manpower. And so healthcare professionals also are buffeted by inflation. We also need to eat. We need to put our kids through school. And therefore, when inflation generally is on the rise, healthcare gets doubly hit.
Yeah, and it's a domino effect. Now, I've heard anecdotally from friends who work or live overseas, right? And they claim that if there's one thing that they are appreciative of, it is our healthcare. I even have a friend who, when she was pregnant, she would actually fly home for her medical appointments. So compared to the rest of the world, just how expensive is healthcare in Singapore?
Well, let me start with the good stuff.
Okay.
We look at the outcomes of our health system. We have some of the highest life expectancies in the world. Infant mortality rates, maternal mortality rates are really outstanding. But all these necessarily come at a price, right? And this price is really higher healthcare cost. So just how high are we? Typically, the US is held up as a paragon of what not to do, right? And the Americans have by far the highest healthcare cost anywhere in the world.
Yes.
And frankly, the Americans don't have terribly good outcomes for this.
That's right.
Right? Hong Kong is also a very, very highly priced destination. But unfortunately, Singapore is rising up and we're really about there.
Okay. So that's a fair comparison of where we stand in terms of how expensive our healthcare is.
Yeah.
Why are Singaporeans particularly feeling the pinch now, though? What's different about now?
Well, what's different about now is that the cost of everything has gone up. So there is a compounding effect. Frankly, we're a bit depressed by all the other changes happening around us.
Yeah.
And therefore, when the healthcare bills come, it is a very unpleasant surprise. And I guess that as society ages, almost all of us would have a loved one who is making regular visits to the doctor, to the hospitals, and it's frankly scary because we look at our parents, we look at our more elderly relatives, and we look and say, wow, in 10, 15, 20 years' time, this could be me.
Exactly.
Yeah.
Yeah, and that's a scary thought, both physically, mentally, emotionally as well, and financially. We've been told time and again that we need to take care of our needs, we need to take care of ourselves. Prevention's better than cure. So it's become part of our Singapore DNA almost
Yes.
to buy medical insurance.
Yes.
And I actually know some people who buy more than what they need or can even afford. So at the very basic level, what is available to me through government funds? So if I were to say get cancer or need surgery, how can I understand these things?
Well, the simplest to understand is to think of a pyramid, and the bottom of this pyramid is really subsidies.
Right.
Government subsidies are the largest component of what helps us to pay for healthcare bills, which is why the anecdote that you started this podcast with is very illustrative. It's a very big bill, but once government subsidies are taken into account, the bill becomes considerably smaller.
Yeah.
Then the second level is really insurance and primarily Medishield Life, which is a national scheme. As long as you're a Singaporean, you're a permanent resident, you are enrolled.
That's fine by me.
But the good thing is that payments of the premiums are automatic. They're taken out of the Medisave account. So in a sense, it's almost invisible to us, right? And if you strip it to its essentials, between Medisave, Medishield as one complex, and government subsidies, these are specifically calculated to provide for subsidized healthcare. So the out-of-pocket or the cash component should be very, very small as long as patients stick to B2 and C-class wards. But you are right also, Andrea, that it's very difficult to find someone without insurance beyond Medishield Life because 7 in 10 of us do have the integrated plans, which are basically plans that sit on top of Medishield Life that gives us more options beyond a B2C class subsidized healthcare in a restructured hospital.
Understood.
And depending on the plan, we can then seek healthcare in the private hospitals or in the private wards in the restructured hospitals, and that gives a lot more optionality.
Right. So basically, your integrated plans are what give you that flexibility to upgrade if you want to. Okay. So I want to talk about Medisave now. And it is a huge plank in managing cost. And the thing is, my neighbor literally came up to my doorstep to ask me this. Hey, you asked this question, you asked this. Why can't Medisave fully cover outpatient diagnostic tests? I'm talking about things like x-rays, MRIs, scans, and this is exactly what he had to pay out of pocket for. And he's wondering why he can't use Medisave to fully cover everything.
Maybe 2 quick comments before I answer the question. Number 1, I'm glad your neighbor is not my neighbor. Secondly, Medisave is an important construct as part of the overall healthcare financing framework, but in terms of percentage of total healthcare spend, it's relatively small. The whole point of Medisave is to imbue that sense of personal responsibility that we all have a part to play, not just in keeping healthy, but in using limited healthcare resources prudently.
Right. So it's watching what you spend, basically.
Absolutely, because it is your own money. However, because Medisave is intended to last you over a lifetime, there will have to be limits and constraints over what Medisave can be used for and what it cannot be used for. And so what the Health Ministry then does is to really look at it from a population point of view and figure out this is worth paying, this is not worth paying for because we need to stretch Medisave across a lifetime. So I'm afraid you'll have to tell your neighbor that yes, Medisave can and does pay for many procedures, many tests on an outpatient basis, but it cannot be comprehensive. But this is a list that is constantly under review. So it will keep evolving. And I guess always good to give feedback.
Okay, I'll tell my neighbor that. Or
Yes.
I'll get him to listen to the podcast.
Oh, yes, better still.
Yeah, exactly. But the thing is, there are going to be instances where we are going to draw down on our Medisave account, right? Our Medisave funds. So what's the upside and downside of increasing usage of Medisave when it does come down to that?
Well, the upside is that we have a nest egg that we've been forced to save, which is a good thing. And at 4% interest, that really until interest rates came out relatively recently, Medisave was a really good deal. And I would actually tell my relatives, if you had cash, pay for it yourself rather than use Medisave, because nobody would give you a 4% guaranteed return. But of course, this entire dynamic, it has changed.
Of course.
But really, Medisave as the discretionary part gives you the optionality, right? And one other thing that's worth noting about Medisave is that it is intergenerational, meaning that Medisave can be used for another first degree relative. So
Okay.
a parent could pay for the child, you could pay for your parents, and really so on. And I guess that this really reflects the overarching societal ethos that the basic building block of Singapore society is the family unit
Yep.
rather than the individual.
Right. Now, a key way to avoid expensive medical costs is to get out of the hospital setting and into step-down care. Now, this would cost quite a bit to ramp up on the government's part. So would it then be cheaper for us if we had to move, say, our elderly parents to rehab? What else would I need to know before making such a decision?
Well, firstly, I really dislike the term step-down care.
Because it makes it sound like a downgrade.
We're an aspirational society. We tell our kids we want to step up, rise up, and then at the end of life, when we're talking about rehabilitation, say, why don't you step down? To be very candid, we have used this language for many years, and I do think that we have, in a sense, sabotaged the willingness of the general public to embrace step-down care. And today we use the term community care much more.
Yes.
Because that's actually much more accurate. We're not really stepping down when we go into the community. We are really going into the place that's most appropriate.
Yeah.
And the unfortunate reality is that healthcare is complex,
Yeah.
and hence navigating the healthcare system, it will be complex. I've been looking at this for many, many years, and my conclusion is really that we only want knowledge just in time, right? When we're young and healthy, the government can put out all manners of campaigns and educational programs. Nobody will care,
Yeah.
right? But when a loved one falls sick, or when we fall sick, suddenly we want to know everything.
Yeah. And when our pockets are hit, especially.
That then puts us in this scenario where there's a tsunami of knowledge and complexity that we then find very difficult to manage.
Yeah, and it's overwhelming as well, because how
Yeah.
do I know that information is meant for me and my case, right?
Well, there are two things that I hope that the government pushes much more strongly, which is already starting to happen. One is to use technology to help us to simplify and to navigate so that we know what the options are laid out in plain English.
Correct.
Secondly, is the human touch, because ultimately healthcare is about trust.
Yeah.
Right? Very few of us would key in our symptoms or the diagnosis, and the machine tells us you should undergo surgery, and we say, sure, let's go. Right? It's really, who then is that trusted intermediary?
Correct.
And because healthcare is inherently complex, I would argue that under the HealthierSG umbrella, where all of us should have our own family physician, then the issue is how then can we help the family physician, for whom this is their bread and butter, to become familiar enough with all aspects of the healthcare system. So whether it's in the community, it's in the hospital, or the family physician and his or her team can then help us when we want to access these services or we want to get this knowledge.
Yeah.
We then have a trusted confidant, we have a trusted guide.
Correct. And it's a nice trickle-down effect that happens there right at the ground level where it matters the most.
Yes,
Yeah.
and at the right time.
Exactly. Okay, so last year, Minister Ong Ye Kung, the health minister, launched HealthierSG, as you mentioned. I think it's a fantastic initiative personally, and it's meant to strengthen primary care provided by GPs. They ensure that not only do you get an assigned family physician to look after you, to know your ins and outs of your healthcare, but to also encourage you to adopt a healthier lifestyle, make that turnaround for yourself, and any medical problems, if they do occur, at an earlier stage.
Yes.
It's tackled and nipped in the bud.
Yep.
How does this initiative actually help cut our medical costs in the long run?
All right. An ounce of prevention is worth a pound of cure.
Oh, I love that.
And that's actually really very true for most diseases, right? If they are avoided or they are detected early, then the interventions are frankly clinically much less traumatic and from a cost point of view, much better for the individual as well as for the system. However, as we talk about HealthierSG, very candidly, the theory is very attractive, very elegant. The practice is challenging because the current care model is, to be upfront, very transactional. The doctors don't have much time to spend with an individual, and the unfortunate reality, say a patient who has got diabetes sees the doctor, say 4 times a year. What happens the other 361 days, right? The patients are on their own. And the reality of getting on with in years or living with a chronic disease is that these conditions are with you 24/7.
Exactly.
Right? And so how then do we leverage the family physician, or more accurately, how does the family physician leverage on community resources, leverage on technology, so that the couple of thousand Singapore residents who are under his or her charge under HealthierSG can be much more regularly attended to beyond the 4 visits a year for diabetes or for really hypertension. And that, I think, is still very, very early stages. I don't see many of my fellow doctors going all in when it comes to technology, being able to commit to their patients that, oh, you have access to me every single week. If you have questions, just type it into a chat bot or anything.
And that goes back to our conversation earlier, Doctor, about trust, about building trust. Trust building requires a lot of that almost day-to-day interaction, that checking in.
Yes, and that's also why it's important that HealthierSG has captured so much of the population. I think at last count, we have over 1 million lives that are under HealthierSG.
Wow.
Because trust takes time.
Yeah.
And the hope is that Singapore residents, when we're young and relatively healthy, build that relationship with the HealthierSG doctor so that when we need help, when we're diagnosed with a chronic disease, when we need to be hospitalized, that's the first port of call.
Yeah. Actually, something like that you would think would tax the doctor a lot, right? Having thousands of patients under his or her care, under the HealthierSG program, but by leveraging technology and other tools available with a stronger framework and structure to help them, they actually feel less taxed because then they can selectively take a look at the patients that do need more urgent help than others.
Absolutely. And here, I think healthcare has so much to learn from banking. If we think about banking, not so many years ago, if you wanted your own money, you had to go to the bank, physically show the documents and count the money. It was a manual, very, very time-wasting procedure.
So laborious.
And then automated tellers came into being. And of course, people were a bit concerned. What if I put my card in? I ask for $100 and only $50 comes out. What is going to happen? But once we got over that hump, we got more confident with the ATMs. The next logical step was online banking, mobile banking. And now for most of us, we'll go to the bank only for the most complex transaction.
Exactly. Look where we are now.
And if we apply that into healthcare, for the kind of routine questions like, what is this drug for? Should I take it after meals, before meals? These are the sorts of very stereotypical questions that can be automated, that we can self-help if the infrastructure does exist.
Yeah, and I think it's better than Dr. Google.
Yes.
More accurate and safer than Dr. Google.
The challenge is when we Google, how do we know we get to the right websites? And
Yes.
here, credit to the government that is done a good job in putting the content online.
Yes.
The challenge then is how do you optimize the search? And here,
Yeah.
I would say there's some work that needs to be done.
Well, I look forward to it. I mean, I think your analogy of taking inspiration from the banking sector, I think that's something that we really could look at. I think that's brilliant. So I'm ashamed to admit, but I have yet to schedule my annual health screening.
Okay.
I will get to it.
All right. Yes, please.
But can there be a case of over-screening, just like over-insurance, right? Is there such a thing as over-screening in terms of the risks that it has?
Yes. And it's not just money, but it's the risk of what we call false positives, where an individual may undergo, say, a chest x-ray and say, oh, there might be something there. Let's put you through a CT scan.
Oh,
right?
those
And
are
the
the
CT
worst
scan
words you
has
want to hear.
radiation risk, contrast risk.
Right.
And then, oh, the CT scan's not that clear. It's indeterminate. We better do a biopsy, right? And the biopsy then results in a pneumothorax or already air in the layer between your lung and the pleural cavity.
Okay.
Then you need to be hospitalized for a few days. And at the end of everything, they say, oh,
Nothing's
it was
wrong with
nothing.
you.
So the World Health Organization has been very clear, even right from the 1970s, what sorts of diseases we should undergo screening for,
Right.
and what are the criteria for an effective national screening program. But unfortunately, we as members of the public are not that well informed.
Yeah.
And health screening has become a commercial business.
Yes.
Because there is money to be made, and perversely, the false positives represent additional opportunities to make money. So we really need to strike that right balance between what is appropriate screening and what should be done on a case-by-case basis.
Yeah.
Right? The Academy of Medicine Singapore has issued guidelines on the different levels of health screening, what is appropriate, what you should talk to the doctor about. But the earlier point that we discussed, how do we make sure that the financials or the incentives align so that doing the right thing is the easier thing to
Correct.
do? If we prioritize health and especially preventive health,
Yes.
we have to make the business models work,
Yeah.
not just for the government, but for the individual doctors, the individual clinics that are supposed to do this work.
Ultimately, that's what HealthierSG is all about. You prevent it so that you don't have to spend so much in the end.
Well, there will always be some of us, whatever we do, we will still be afflicted with disease, cancer, with heart disease. But that's why we are a country. That's why we are a nation, and we risk pool.
Yeah.
So please do pay your taxes and pay the premiums for MediShield Life and all, because hand on heart, we don't know. A year from now, 2 years from now, is it going to be us?
Yes.
Is it going to be our loved ones who will need that bed in the intensive care unit? And if we don't look after the health system well, it's not going to look after us when we most need it.
That's a lovely note to end off this conversation. Dr. Lim, we thank you so much for walking us through your thoughts on this. Now, before we let you go,
Yes.
there's a really fun segment
All right.
unique to the Money Talks podcast.
Okay.
It's called Questions from a Hat. So there are a number of questions written on pieces of paper in this hat. So pick one, hand it over to me, and I'll read it to you.
Sure.
All right. So your question from a hat is, what is pricey but always worth it? I feel like I know what your answer is going to be.
Well, I'm not going to say health insurance,
Okay.
right? I would say high quality luggage.
Okay.
I do travel a lot.
Okay.
And it's a disaster if your luggage breaks down or gives you problems when you're on the road.
right.
And there are some things that are worth paying for.
Yeah. And some things that are in that luggage that is absolutely sentimental, that's
yeah.
priceless. You want to make sure it's
Yeah.
well guarded.
And maybe let me just bring it back to healthcare. It's worthwhile to pay more for quality and for peace of mind.
You and I are in the same boat, except I'm not a doctor and I don't earn a doctor's salary, so I can always subscribe to that. But Dr. Lim, it's been a pleasure to talk to you.
Likewise. Thank you so much.
It is our pleasure to have you as well. And dear listener, we hope there was something to take away from this very special episode. I hope my neighbor's happy with that as well. If you have any thoughts or questions about this topic or others, slide into our DMs. You can find Money Talks on Apple Podcasts, Spotify, and YouTube Music. Don't forget to rate us and subscribe as well, so you'll always know when a new episode drops. Thanks to the team, Crispina Robert, Tiffany Ang, Junaini Johari, Joanne Chan, To Yen Yun, and Saye Win. I'm Andrea Heng. Thank you for listening to Money Talks.